direct-to-consumer advertising, I think, is a great disservice in general to the American people. We see these wonderful ads of these people, demonstrating their wonderful health, whether they're skating across the ice or they're doing their Tai Chi or whatever it is. And you get this visual impression. And Madison Avenue knows that a picture is worth 1,000 words. And so they convey an image and they convey a message. And it creates needs or desires where there really isn't a need or a desire.
The endless variety of medicines on the market, the numerous advertisements of drugs and mixtures, all of which they say do wonderful cures, kill hundreds, but they only benefit one. Those who are sick are not patient. They will take the various medicines, some of which are very powerful, although they know nothing of the nature of the mixtures. All the medicines they take only make their recovery more hopeless. Yet they keep dosing and continue to grow weaker until they die.
Many of these doctors should be ashamed of themselves for how they practice medicine. They did take a Hippocratic oath to preserve life, not to maximize their salary.
All I want are nights with less pain and mornings with less stiffness, so I can get out here early and show these clams who's boss.
It's amazing. I'll have people come into my office. Oh, Doc, I saw this advertisement. I want that. Gee, I saw this ad where the stomach is on fire. I need that. My stomach is bothering me. So what it does, it's not a good idea because it's promoting drug therapy when we don't know what the disease is. And that's the problem with a lot of medical practice in our country today. We are too prescription-oriented. Oh, you have a stomach ache? You better take this. You have a headache? You take this. Oh, you're depressed? You take this.
There are more who die from the use of drugs than all who would have died of disease had nature been left to do her work. Very many lives have been sacrificed by physicians administering drugs for unknown diseases. They have no real knowledge of the exact disease which afflicts the patient, but physicians are expected to know in a moment what to do. And unless they act at once, as though they understood the disease perfectly, they are considered by impatient friends and by the sick as incompetent physicians. Therefore, to gratify erroneous opinions of the sick and their friends, medicine must be administered. Experiments and tests tried to cure the patient of the disease of which they have no real knowledge. Nature is loaded with poisonous drugs, which she cannot expel from the system. The physicians themselves are often convinced that they have used powerful medicine for a disease which did not exist, and death was the consequence.
I left my conventional Western medical practice after 10 years because I was told to churn out 25 patients a day because reimbursements from insurance companies were down. And then I had my internal pressure of feeling bad that I'd make patients wait for hours because I was trying to do the right thing by them. And I actually quit my job because of the stress I had chest pain. I mean, I was really stressed out because I had this pressure on me to practice a way of medical care that I felt was just not good.
Part of it is that they're getting nickel and dime by HMOs to spend only 5 or 10 minutes with a patient, much faster to write a prescription than to talk through a prescription for a lifestyle change.
Look at Lipitor. 20 milligrams, $272 what you pay. Their cost $580, 4,500% markup. Then look at the real big one, Prozac. Prozac, 20 milligrams, cost you $247, cost them 11 cents. 224,000% markup. But they're not the worst of them. The worst of them is Xanax. 1 milligram, 1 little milligram. You pay $136, it costs them 2 cents. They make a 569,000% markup.
Oh, how much that poisonous drug cost. If it did not cost a life, it costs quite too much.
All the other potential treatments, all the other potential prevention strategies are pushed out, are overlooked, are ignored because of the dominance of this rich, powerful voice.